Welcome and thank you for joining us this morning. Over the last year, I've been very transparent about the challenges we face as an independent community hospital with an aging population, rising costs, shrinking reimbursement from Medicare and Medicaid, as well as the commercial insurers, and increasing labor costs and just costs in general. Continuing operations in that model is no longer sustainable. Today, I'm pleased to announce that pending regulatory review, Evangelical Community Hospital will be partnering with WellSpan Health. WellSpan is a multi-hospital health system with locations and services throughout South Central Pennsylvania and parts of Northern Maryland. This decision, while hard, is the right decision. Joining WellSpan represents the best path forward to continue meeting the health and wellness needs of the community well into the future. Together, we will preserve a vibrant local healthcare system by partnering with an organization that has demonstrated a commitment to the communities it serves in keeping healthcare local. WellSpan shares our mission, is aligned with our culture, and has an excellent reputation for patient-centered care. As a larger healthcare system, joining WellSpan brings exciting opportunities for Evangelical. The ability to remain on the Epic platform and experience more consistent support. Greater access to technology, potential to expand clinical offerings to our community, access to care delivery innovations, access to educational resources to build a pipeline of healthcare workers. WellSpan will invest more than $100 million in the hospital over the next 3 years, which will provide us with the opportunity to explore new technologies, new equipment, build or renovate existing facilities, and potentially expand clinical services. Right now, nothing changes as we have at least a 4-month regulatory review process to navigate. However, things will change over time. This type of decision is made because things do need to change in order to continue delivering on our promise to the community. There will be some key changes after completing the regulatory review process, including the rebranding of the hospital to WellSpan Evangelical Community Hospital, and a thorough evaluation of business functions to focus on value and efficiency. It's important to understand clinical services will continue uninterrupted and growth will be a focus. Our patients will still be able to access the providers, services, and facilities they've come to trust for their health care. At this time, I'd like to welcome Roxana Gapster, WellSpan's President and CEO, to the podium.
Thank you, Kendra, and welcome everyone. I'm honored to be here along with my board chair, Hilda Shirk, and some of the members of the WellSpan executive team. As Kendra mentioned, our WellSpan vision is to be a trusted partner to our communities. To inspire health in our friends and neighbors, we understand the deep commitment that needs to be made to work alongside community-based organizations and other partners. When we embarked on our journey to reimagine healthcare at WellSpan, we committed to the strategic priority of innovation while committing to keep healthcare local. We're excited to build on that commitment with the Evangelical team. When health outcomes improve through innovative care models, strategic partnerships, and a strong sense of purpose, it creates a fantastic combination. For more than 3 decades, WellSpan has enhanced access to exceptional care across South Central Pennsylvania and Northern Maryland. Over those years, we've created a strong network of physicians, hospitals, and ambulatory care sites to create greater value. We're excited that Evangelical Community Hospital's affiliation will provide a similar path in the central Susquehanna region. Together, we can create exceptional, high-quality, affordable care to more than 1.3 million patients across 12 counties. Thanks.
At this time, I'd like to invite Tim Moyer, Chair of Evangelical's Board of Directors, to the podium. Tim?
Thank you. As Kendra noted in her comments, the decision to join another organization is a hard one, but the Board of Directors believes it is also the right one. Over the last year, the Board and the executive leadership team worked extremely hard, exploring a variety of different creative solutions. during that time, we got to know WellSpan Health and the people shaping its path. And I have to say, I was immediately struck by what a solid match these two organizations are for one another. WellSpan shares our vision and our values. They place a premium on their people, their patients, and the communities they serve. And as we know, that's been Evangelical's focus for nearly 100 years. So I'm very confident in the match we found. Prior to stepping in the role of board chair, I served as the chair of our philanthropy council. So it's important to me to note that a separate foundation will be created to give the community a pathway to continue supporting Evangelical. This will ensure that donations from local community members and businesses continue to positively impact healthcare locally. Contributions will stay with Evangelical, including endowments and restricted donations as directed by donors for the provision and delivery of healthcare services here in this service area. On behalf of the board, I can tell you that we are excited about the opportunities ahead. We are committed to making this transition a successful one for our staff members, our patients, and our community. Thank you.
Thanks, Tim. In addition to Tim Moyer and Roxana and Hilda, their board chair, I have here today Dr. John Turner. He is Evangelical's Medical Director of Cancer Services, and he's Clinical Co-Manager of the Thyra M. Humphreys Center for Breast Health. But the key is he's currently the President of the Evangelical Medical Staff. I have Jeff Kapser, who is the Vice Chair of the Evangelical Board, Dr. Tony Aquilina, WellSpan's Chief Physician Officer, Laura Bukowski, WellSpan's Chief Financial Officer, and Cindy Fruitrail, WellSpan's Senior Vice President and Chief of Staff. So thank you all for joining us in making this historic announcement. In closing, I want to be clear about something. This community's support has helped sustain and build Evangelical's nearly 100-year tradition of delivering on its promise to nurture the health and well-being of our community. I'm looking forward to the community's continued support as we enter this new chapter of our shared mission with WellSpan Health. At this time, I'll open the floor to any questions you may have of any of us. Yes.
So you had said nothing's going to change in the first 4 months, but after the 4 months, will there be layoffs?
You know, at this point, we don't know what will happen. We know, and I'll speak for Evangelical, we know that we have to do something, that you just can't sustain the operation without having scale. And one of the things WellSpan brings to us is the ability to look at our functions and see where we can be more efficient. And so that is really what we're going to look at. But at this point, nothing changes until we get through this process and until we can work together without all the rules and requirements to be able to see how we are able to fit in within the structure and become more efficient.
Kendra, you tried this with Geisinger and it didn't work through the courts. Are you confident that you can overcome any obstacles that were created at that situation with WellSpan?
Sure. It's a very good question or a good comment. You know, from the time I took this role in 2015, it was clear we needed to do something, and you could see it long term. Certainly COVID accelerated and exacerbated the challenges, but we tried to look at healthcare locally and see what we could do with Geisinger, as you know, they're our partner in the sense of delivering healthcare in this region, and the federal government said it was anti-competitive. We're extremely confident in this. You know, 3 players still remain in the market, which is part of what they will look at, and WellSpan currently is not a provider in this part of the state, and so I think it, in my view, and it's a limited view at that, but I think from my perspective, I think we should have no challenges in getting through the regulatory process, other than these things are out of our control as far as how quickly they react to certain things. But we're very confident from an antitrust perspective.
Since Evan has been here for so many years as the local hospital, how are you going to explain, and there will be many, many questions and comments to the community at large about how this will affect them and how it will be very good for Evan and for the community.
Sure. I mean, I think, we've prided ourselves on being able to stay independent, but what we've prided ourselves more on is the care of the patient. And I think one of the things that was attractive to me about WellSpan is, that we are very proud of the fact we're a 5-star CMS hospital and that we're an A-rated Leapfrog hospital. All of WellSpan's hospitals are either 4 or 5-star CMS hospitals. They're also either A or B Leapfrog hospitals. They have 6 hospitals that right now, and they place the same importance on the care of the patient. And that's what we're here for. I mean, my job, again, is to ensure that this hospital is here long after I'm gone from this earth, and, to make sure that the people in this region get care. And there's never been a greater demand for care than there is right now because of the aging of the population. The business model of healthcare is challenged, and you just can't do it alone. And so for me, I resonate with WellSpan's mission, their culture, and how they care for and about their patients. And so I think that you won't, as an individual, see change. You'll be able to still see the same providers, still receive the same services, and I think ultimately you will see more and better and greater clinical services, which is what we're here to do. But it will take time, and it will take trust by the community that we are focused on their best interests in making sure they get the care that they need, and that it's of a quality that they deserve. And I think we will get that through our relationship with WellSpan Health.
Thank you.
Sure. Yes, Justin.
A few years ago, we had another independent hospital not very far from here get scooped up by a larger organization. We all know how that turned out. What can you say to the people to say that's not going to happen here? What makes you confident that this is going to work out?
So I'm going to assume that you're talking about
UPMC and Sunbury Hospital.
And Sunbury Hospital, sure. Sunbury Hospital went through a variety of iterations before they landed with UPMC. I think there's a lot that went into that. Whereby the economic health of a community goes the economic health of healthcare. We happen to be in a pretty solid region. I also would say to you that I think that Sunbury waited until it was more at a tipping point. Evangelical is in a strong financial position. We made this decision proactively, so we didn't hit the tipping point, so to speak, that they hit. We have been able to attract top-notch staff. We have an excellent medical staff. We've been able to, even in these challenging times, recruit and retain staff. That was something that they were challenged by. So it's really not an apples to apples kind of comparison. I think that what I would go back to on that answer is that we are trying to be proactive to make sure that we don't get destabilized. And we're still a strong entity, and we are in a strong region, and people like the patient experience here. They like the care that they get here, and that's going to continue. So I think that's a little bit of the difference. But the similarity is that Sunbury had a high Medicare population, and that happened much sooner than what we've been experiencing here. But this whole region is experiencing, and the whole state of Pennsylvania is experiencing those kinds of challenges. And so you have to figure out how to reduce cost, and you just can't do that when you're alone and an independent.
What's your position going to be in the?
So, obviously I have more time behind me than I do ahead of me, as they say, but I am committed to making sure that this relationship works. So until the time that I decide to retire, we are going to be WellSpan's Northern Region, and I will remain the president of WellSpan Evangelical Community Hospital, and I will serve on WellSpan's senior leadership team as a senior vice president of the North Region to ensure that the promises we've made to each other get actualized.
How many hospitals does WellSpan have?
Well, see if you can test my knowledge here. WellSpan has 6 hospitals and 2 specialty hospitals. One is a surgical and rehab facility of their specialty hospitals, and one is a behavioral health hospital that is also part of the behavioral health system.
So this will be the 7th.
The 7th main hospital plus the other 2.
Okay.
See, if you test my knowledge, you'll just test my knowledge to rattle them off. But other questions?
Yeah.
Yeah, just.
Partnerships with Geisinger are obviously still a big part of EVAN's model. What is going to happen to those partnerships moving forward with WellSpan?
Sure. I think, Geisinger is part of, and a huge part of healthcare delivery in this region. We've spent a lot of time talking about that. Your insurance dictates where you go if there's services that we can't provide, and we intend to continue to participate with Geisinger and continue to have a relationship. People have choice where they go when we can't do the care, and, I think we will be able to maintain a relationship with them, although it'll, be slightly different in that they will no longer have a minority interest in us. But we intend to, you have to maintain a relationship in this region in order to ensure that patients get the best care.
One last question
Sure.
for me, and that is, did you look at other healthcare systems before you decided to go to WellSpan?
Sure. This process started probably 15 months ago, and we met as a board, an executive team, talked about the challenges, hired a consultant to also put their lens on us to make sure we weren't missing things, and it was at that time that we all agreed that we needed to seek out a partner. So at a certain point, we sent out an RFP, a request for a proposal, and we talked to a variety of organizations. We went through learning about one another, deciding whether we fit together, in all honesty, and how each of those organizations would best serve our region. And the board, after going through that process, agreed that WellSpan was the most optimal partner for us.
You mentioned a large capital investment coming your way over the next 3 years. What services might you be hoping to use that to expand or improve upon?
Sure. I think that's the stuff that will come from our further conversations. Evangelical's losses over the last years have kept us from doing our usual investments in people, technology, facilities, all of that. So some of the capital, or some of those dollars, will support just our routine capital to get us up to speed with new equipment and things like that that we have need of. And then I think the rest are more strategic, looking at where are there gaps, where do we feel that we need help. We've talked about, the strength of this organization in orthopedics and maintaining a center of excellence. We've talked about some of the challenges in the volumes that are now coming into the emergency room. Are there opportunities there? But those are the things, in all honesty, we haven't been able to talk about at great length because we're not